All right, good afternoon, everyone. Hope everyone had a great lunch. This session will cover public reporting and the quality reporting program reports, so all your CASPER reports that you've been reviewing as you start data collecting. So here are the acronyms. It's listed on your slides, or I saw that you also have handouts to go over these acronyms, so I'm just going to quickly go through these. So the objective of this session is to navigate the LTAC and IRF-Compare websites, which displays all your quality measure results publicly. And next is to identify the types of quality measures by data source. Then describe the purpose of the reports available for IRF and LTAC quality reporting programs. And then for each report, identify how those reports are helpful for your quality improvements. So we start out with the Compare website. So as you all know, the LTAC and IRF-Compare websites are up, and you are able to, and the public are able to access quality measure results. And the public has the ability to search for a facility by geographic location, so city, state, zip code. So the web address is below the screenshot, but you can also go to a search engine, type in IRF-Compare or LTAC-Compare, and it will, usually the first hit is the Compare website. So here's the home page. On the top header, you can actually, under long-term care hospital compare right there, you can switch between all the other compare websites. And to the upper right, you have the About page, which has additional information about the compare website, such as the data source and other contact information. And then the box below, you can type in a zip code, city, state, and it will pop up some results. The nearest, I think by default, within the first 50 miles. And you can see right there is the results page. So let's say you type in, it looks like Boston right there. You see the surrounding, the closest LTACs that closest to within 50 miles from the zip code or city state that you inputted. So. And there's the IRF-Compare website, same thing. And here, this example looks like Denver, Colorado, and I'll show you the nearest IRFs around the Denver area. So every time you click on a facility or you add in facility up to 3, you can compare. You'll see the measure results page. And here, for example, you can see results such as the rate of pressure ulcers that are new or worsen. In the screenshot, you'll see that you can hover over the quality measure, and it'll show this hover text, which defines the quality measure itself. And there's multiple ways of looking at the data. We have a table view and a graph view. Both shows kind of different results. So for the assessment-based measures, so anything from the LTAC here dataset or the IRF-PAI, you'll have the table view and then the graph view, which shows a low bar graph. However, for the claims-based measures, it shows the data a different way. So the table view shows, I think, the comparison group and the national average. And if you go to the graph view, you should see the facilities, let's say, for example, readmissions, the readmission rate, the confidence interval, and the national rate. So, and you can also download all this data from data.medicare.gov. So that way you can download it, manipulate it however you want, and it's readily available for you to download. And then so at the home page below where you search for a facility, there's additional information. So spotlights are pretty much the announcements, any let's say new quality measures that are available, or any other announcements. In the middle is tools and tips. So you can actually, let's say, click on the middle link, and they'll show you the other compare websites that's available. And then to the right is the additional information. So I think a link to the data.medicare.gov, contact information, help desk contacts, etc. So now we'll go over the types of quality measures by data source. So there are 3 different types of data source. The first being the assessment-based measures. So for LTAC, it's the LTAC care data set, and for IRFs, there's the IRF-PAI. There's the CDC NHSN measures, and then the claims-based measures. So for both the IRF and LTAC QRP, for the assessment-based measures, we have the percent of residents or patients with pressure ulcers that are new or worsened, percent of residents or patients who were assessed and appropriately given the seasonal influenza vaccine, the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function, and then the application of percent of residents experiencing 1 or more falls with major injury. Measures that are specific to the IRF-QRP are your functional outcome measures. So the first being the change in self-care score for medical rehab patients, the change in mobility score, the discharge self-care score measure, and then the discharge mobility score. And those specific to the LTAC QRP is the percent of long-term care hospital patients with admission and discharge, functional assessment, and a care plan that addresses function, and the functional outcome measure, the change in mobility among LTAC patients requiring ventilator support. And you can see the first measure is almost the same as the cross-setting measure, so the application measure. So the application measure is cross-setting, so IRF, LTAC, and SNFs have that measure. And there's an LTAC-specific process function measure that contains additional items that are not in the cross-setting measure. So that's the difference between the two. It looks the same, but it can be a little confusing. But so for the CDC measures, both in the IRF and LTAC QRP, we have the catheter-associated urinary tract infection outcome measure, the MRSA outcome measure, the CDI outcome measure, and the influenza vaccination coverage among healthcare personnel. And the CDC measures are unique to the LTAC QRP, is the central line associated bloodstream infection outcome measure, and the ventilator associated event outcome measure. And for claims-based measures, we have the, for both the IRF and LTAC QRP, the all-cause unplanned readmission measure for 30 days post-discharge, and that is slated for removal from LTAC and IRF Compare by October 2018. And we have the new claims-based measures, the potentially preventable 30-day post-discharge readmission measure, the discharge to community measure, and the Medicare spending per beneficiary. And one that's unique to the IRF QRP is the potentially preventable within stay readmission measure for IRFs. So we have our first knowledge check, so get out your phone and we can go over this first question right here. So Medicare spending per beneficiary is an example of which type of quality measure? Is it A, CDC NHSN measures, B, assessment-based measures, C, claims-based measures, or D, none of the above? So looks like very close to unanimous, but it is the C, claim space measures. So now we're past public reporting, and we'll go over the CASPER reports. And there are three types of these reports. So first being the review and correct reports, then we'll go over the QM reports, and then the provider preview reports. So here's a little overview of the reports. So if you look at the bottom row, you'll see that this is kind of the road to public reporting, or what's posted on the Compare website. So you'll see review and correct reports, then it goes on to the provider preview reports, and then the Compare website. So we'll go over that kind of little process. And then the top row is the quality measure reports. So the review and correct reports, so these are the user on-demand reports, and it's confidential to providers. And this display, so these are quarterly reports. So when reporting quarter ends, the report is available the next business day. So currently today is May 8th, so this is quarter 2, 2018. So the report end date so you will be able to see the quarter 2, 2018 review and correct reports on the first day of July, first business day of July, which is July 2nd. So on July 2nd, if you go to the CASPER system, quarter 2, 2018 will be available for you to see your data and review and correct. So right now, what's currently available is the quarter 1, 2018 quarter end date report. And so these are available for providers to run with updated data weekly until the data correction deadline. So let's say you correct your data today, and so your correction will reflect upon the data next Monday. And actually, next week is the week where May 15th. So that's the data correction deadline. So probably the week after that, it's the last time that the data will be refreshed for. So this is May 15th. So it's quarter 4, 2017. So May 15th. So next week is the last day. That day is the last day to correct quarter 4, 2017 data. So 4.5 months after the end of that quarter. So that's the last day. And then the review and correct reports also displays the data correction deadline and whether the data correction period is open or closed. So right now, quarter 4, 2017 is considered open, but by May 15th next week, it will display as closed. And these review and correct reports, as I said earlier, is accessed through the CASPER system, and it provides a snapshot of current performance based on what you submitted in the key system. And it contains quality measure information at the facility level, and it's only for assessment-based measures only. And these reports only displays the observed data, and no risk adjustment rates are shown. And so providers are able to obtain aggregate performance for up to past 4 full quarters as data are available for. I think all the quality measures right now are in rolling quarters, so pretty much. So right now, if you request quarter 1, 2018, you should be able to see quarter 2, 2017, quarter 3, 2017, quarter 4, 2017, and quarter 1, 2018. So 4 full quarters of data. And then usually when there's a new quality measure, it starts off with just 1 quarter of data, and it stacks to become a full year of data, but now I think all the quality measures now have 4 full quarters of data. So, and you can see at the bottom that I kind of explained that. And also you'll see that it displays each quarter, and then the cumulative rate is the bottom row of the report. So, and as I said earlier, most of I think all the quality measures right now are in rolling quarters. So that means when a new quarter gets displayed, the oldest quarter gets dropped. So, and here's the table that shows the data collection periods and then the data correction deadlines. So you see, let's say at the bottom row, quarter 4, let's say 2017. So that covers October 1st to December 31st. And right now we're in the middle of that data correction period, and it ends on May 15th. So, and right now we're currently on quarter 2, 2018. So that covers April 1st through June 30th. And the data correction period for this quarter ends on November 15th. So quite a bit of time. And as many of you have seen, this is the review and correct reports. So on the top, you'll see your provider information, and then the measure name, this CMS measure ID, and then your quarterly results. You'll see the start date, end date, data correction deadline, whether the data correction period is open or closed, then your numerator, denominator, and then the observed percent, which is numerator divided by denominator multiplied by 100. So, and then you have your cumulative rate below. And remember, the cumulative rate is not the average of the 4 quarters, but it's the aggregate. So pretty much you have to add up the denominators, add up the numerators, and then divide to get the observed rate for your for the full year. And then this is the second example, so pretty much showing that as the new year becomes available, you'll see the first quarter, the newest quarter is on top, and then the oldest quarter, quarter 1, 2017 gets dropped. So the oldest quarter right there is quarter 2, 2017. So we have some exciting enhancements coming up with the review and correct reports. So we've listened to a lot of your feedback, and there will be upcoming enhancements to the review and correct reports for spring 2019. So right now, you see only the facility level data, and the new review and correct reports coming out next spring will add in patient level data to supplement the facility level data. So it will be pretty clear which set of patients go with which quarter of data you have at the facility level. So it'll be a lot easier to track. So, and these reports will now be sortable. So the PDFs, if you download the PDFs, you can pre-sort them. I think this is not limited. I think it's last name, patient ID, patient status. I think you can do discharge date, admission date. So there's a lot of options. There's also the filtering of data. It's not here, but you're able to filter. So let's say you want to include patients that had a new or worsened pressure ulcer. You can filter based on that. This would significantly reduce the number of pages that you have. I know a lot of you have lots of pages to review, so this would significantly cut the number of pages you have to review. So you can also filter by a quality measure, and there's a lot of sort and filter options that will be available next year. And if you don't like the PDF reports, there will be a CSV file for you to download, so you can put it in Excel and do all sorts of managing, sorting, filtering, however you like. So on top of not having to go through all the PDF pages, you can just download the Excel file, so it'll just pretty much be a flat file. So the header will be just the variable names and then pretty much the data. So, so that is coming up next spring. So it'll be a lot easier for you all to review and correct your data. So currently, how to obtain the review and correct reports. Go through the key system homepage, click on CASPER reporting, log in, and then on the top bar you'll see reports, and then it should appear at the bottom what type of report you want to request on the box to the right. And then on the drop-down box, you pick a report end date. Let's say, well, this is the very beginning. So let's say you pick, let's say, Q1 2018 as the end date. The begin date should auto-populate to the previous 4 quarters. So it'll be Q2 2017 as the begin date, and the end date is Q1 2018. And once you submit that request, it should be in your inbox. So, and that's shown right there. All right, so knowledge check number 2. So the review and correct report provides information for which type of quality measure. A, CDC and HSN measures, B, claims-based measures, C, assessment-based measures, or D, all of the above. All right, so we have about two-thirds picking assessment-based measures. So let's see what the answer is. Oh, 3/4 picked. And this is the assessment-based measure. So most of you picked that out. So we'll see in the next set of reports, the QM reports that contains the other measures. So review and correct is just for the assessment-based measures. All right, so the quality measure reports, or the QM reports. So these are also referred to as the confidential feedback reports, and it's also, like the review and correct reports, are user-requested reports available in the CASPER system. And these are also available to providers prior to public reporting and are used for internal purposes only and not for public display. And these are also used for feedback to help providers to improve their quality of care. And this right now contains quality measure information at the facility and patient levels for a single reporting period. And available on demand, just like the review and correct reports. And providers are able to select the data collection end date and obtain aggregate performance data. The only caveat is the claims-based and the CDC measures are not included in the patient-level reports, but they are included in the facility-level reports. So here's an example of a facility-level quality measure report. So you see on the top, kind of similar to the review and correct, you'll see the facility-level information. To the right is the report period. So this report right here is the report end date is September 30th, 2017. And whenever you request a report, it goes back a year. So report end date is September 30th, 2017. So it goes back to October 1st, 2016. So you'll always get a single reporting period or 12 months of data. And then at the bottom, you'll see the measure name, the data source on top, then the quality measure name to the left, the CMS measure ID, numerator, denominator, the observed percent, and then if the measure is risk adjusted, you also get the risk adjusted percent, and then the national average. So you can compare your facility with the national average. And then here's the example of the patient level report. So So when you request the facility level QM reports, you also get the patient level QM report to tag along. So you'll see the status legend on top, whether the quality measure was triggered, not triggered, whether the stay was excluded from the measure, or if the data is not available. So you'll see at the bottom, you'll see the data source, the patient name, patient ID, and admission and discharge date, and then in this example here is the pressure ulcer measure and the falls with major injury measure. So you'll see for example, Mary Doe was not yet discharged from the facility, so you'll see there that's why the data is not available yet. So you'll see the X's indicating, so say Fred Doe had at least one or more new or worsened pressure ulcers. So for the influenza measure, the table works a little bit differently. So for if there's a yes for one of the sub-measures, then it's a yes for the overall measures. If it's a no in all the sub-measures, then it's an N for the overall measures. So to qualify for to be included in the numerator for the influenza measure, the patient must be either was administered the vaccine, had a contraindication, or I think refused the vaccine. So if one of those sub-measures are yes, then the overall measure is considered a yes. It works a little bit differently. So these quality measure reports are refreshed monthly, but you are able to request a report end date a little bit earlier than the review and correct reports. So for example, this quarter is quarter 2 2018. So you actually can download your data for this quarter at this time. So for example, the report end date for quarter 2 2018 is June 30th, 2018. So right now in the CASPER system, you can request the report end date of June 30th, 2018. So it goes back 12 months, and that's July 1st, 2017 through June 30th, 2018. But right now we're still in May, but you can still see the data for this quarter. So it's it's slightly more real time than the review and correct reports. So you'll be able to see the data for this quarter a little bit early. And that's usually available the first month after the beginning of the quarter. So for quarter 2 2018 data, May 1st or May 2nd, I think, is the first day you're able to download this report end date. And this is a snapshot of performance for quality improvement purposes based on data submitted, and then you also get the risk-adjusted results if applicable. And like I said before, the review and correct reports and QM reports are refreshed differently. They work in different ways. So for example, if you correct your data after the data correction period for the review and correct reports, it will not be reflected in your review and correct reports because the data is frozen. However, the QM reports are more of a data dump, more pretty much like whatever's in the system, whatever assessments you submitted and whatever assessments you corrected, it would reflect at your facility rates in the QM reports. But the review and correct reports are technically the reports that are eventually be publicly reported. So once the data is frozen for public reporting, it stays frozen. But for your QM reports, it's more still a kind of a whatever data you submitted is reflected. So the QM, how to obtain the QM reports is almost the same way as the review and correct reports. Go to the CASPER reporting, the key system homepage, click on CASPER reporting, the login system, And then you click on the reports, and I think it's the same thing. You click on facility QM reports, and then you do the report submission page. I don't have a screenshot right here, but pretty much so the only difference is for review and correct reports, you see quarter end date. You'll see like quarter 1, quarter 2. But for the QM reports, you see a report end date. So it uses a date as opposed to the quarter. So if you want to request this quarter, it doesn't say quarter 2, 2018. It'll say June 30th, 2018 instead. So the third knowledge check. So which report currently displays patient level information? Is it A, the review and correct report, B, provider preview report, C, QM reports, or D, none of the above? Oh, I did. Yep. There. Oh. Oh, 175%. But yes, it is. Well, it is the QM report. So we'll get to the answer. Yes, it is the QM reports. So, and lastly, the provider preview reports. So pretty much once the data is frozen, it leads to the data frozen in the review and correct reports. It leads to the provider preview reports. And the provider preview reports contains facility level quality measure data, and these are automatically generated and saved into your inbox in the CASPER system. And this will be pretty much your preview to what will be displayed on the Compare website. And it's usually available about 5 months after the end of each data collection quarter. So after the data collection period has ended, providers you're unable to correct the underlying data in these reports. And so please submit your corrections prior to the quarterly data submission deadline. So next week is the last day to correct quarter 4, 2017. So once you receive the provider preview reports, you have a 30-day preview period to review and submit. If there's something wrong with your data, you feel like there's something wrong with your data, you submit a suppression request. But we'll get that. We'll discuss that in a bit. And so in the provider preview reports, at the bottom of the provider preview reports, you should see important notes. So you got your help desk information, and just pretty much saying that the order of the measures in the reports don't really reflect what's on the Compare website. Same with the titles. We use more the consumer language titles as opposed to the technical titles that you see in your provider preview reports. And there is a crosswalk between those titles, so that way you can see the technical title and the corresponding consumer language title. And here's a mock-up of the provider preview reports, slightly a bit different than what you see. You'll see later on what you actually receive, but this is kind of an overview of the provider preview reports. So on top is your facility level information that would be on Compare, and then your quality measure, numerator, actually that's denominator and risk adjusted rate, and then the national rate. And below that is the footnote legend that would apply if applicable, and then the important notes that we just discussed earlier. So there are a list of footnotes on the provider preview reports, which corresponds to what you see on Compare. So the first footnote is the number of cases or patient stays too small to report. So for, I think, all the assessment-based measures is if the number of stays is less than 20, then we put a footnote there instead. And it's there because it's too small to reliably tell how well a hospital is performing and also to protect personal health information. Number 2 is data not available for this reporting period. So if you've been open for less than 6 months or you had no data to submit for this measure, 0 device days for the CDC measures, or your LTAC or IRF had no claims data, then we put footnote number 2. Footnote number 3, if the results are based on a shorter time period than required. So if the results are, let's say, 3 quarters as opposed to a year, I don't think we ever had this situation yet, but if it were the case, we would put in footnote number 3. Footnote number 4 is when data suppression by CMS happens. Number 5, data not submitted for this reporting period. So provider did not submit required data for the QRP, or if the provider did not submit CDC data to the NHSN system. Number 6 is CDC specific. So if your number of observed infections is equal to 0, then then the lower limit of the confidence interval cannot be calculated. And same with number 7, similar to number 7, CDC only, but if, according to the model, the predicted number of infections is less than 1, so pretty much if your observed number of infections is really low, then usually those results can't be calculated. And then 8 is, I think pretty specific to the state of Maryland, but it's the LTAC or IRF is not required to submit quality data to Medicare because it is paid under a Medicare waiver program. And here's the provider previews you guys actually received. So it was a text file, pretty much the same thing as you saw in the previous slide, but it is more of a simple plain text report. Because you have the reporting periods on top, your provider information, and then pretty much your quality measure information in the bottom. And how you get these reports is pretty much when it's released, it's automatically placed in your inbox, so in the CASPER system. And then there's a variety of resources. You can go to the KITSO website. First link is LTAC, and then the second is for IRF-PAI users. So you all receive these provider preview reports quarterly, and they're delivered in your inbox. And you have a 30-day review period you have 30 days to look at the report before it is posted on Compare. And CMS encourages providers to review data prior to public display each quarter. And if you disagree with the accuracy of the performance data, then you can submit a request to review that data to CMS. And there is a process. So you can submit the request during the 30-day review period. But you will not have any way of correcting the data. So after the data correction period, the data is frozen. So the only way to kind of review it, the only way to not report and compare is suppression of data. But that it has to be pretty much a major calculation error. So anything that you want to correct, that time is up by the time you receive the provider preview reports. And you can submit these requests to the public reporting help desks. So for the first is the LTAC public reporting help desk, and then the second is the IRF public reporting help desk. And in the subject line, include your provider facility name, and the CCN number. So you'll see the example below what you need to put in your subject line. And in the email request, the information should include the information that's on the slide. So CMS will review all the requests during the review period, and please do not send protected health information. It has happened before, so make sure to not include protected health information. So now let's check number 4, which report displays results that will be posted on the Compare website. Is it A, provider preview report, B, QM reports, C, review and correct reports, or D, confidential feedback report? All right, so it is, so we'll get to the answer, and most of you picked the provider preview reports, so very good. So the 5th knowledge check, the IRF and LTAC QRP reports reviewed can all be accessed through A, automated survey processing environment, B, National Healthcare Safety Network, C, quality improvement and evaluation system, or D, the certification and survey provider enhanced reports system. And excellent, so it looks like many of you picked the correct answer, the CASPER system. Number 6, requests for CMS to review your provider preview report data must be submitted via email. Is it A, true, or B, false? We can get to number 6. There we go. Yeah. So we'll get to the answer, and it is true. So, all right, true. And lastly, number 7, the provider preview report provides A, 15-day preview period, B, 30-day, C, 60-day, or D, 90-day. Get to the poll. No worries. Guess he did for me. Well, it is 30 days, so we just went over it. So, all right. Lastly, we're going to talk about ensuring accuracy on your facility information. So, if what you see in the provider preview reports or any other reports, if you see your facility information is outdated or you need to update, it is important to update your data within the Aspen system and not your data on the Compare site. I think the Compare site just grabs the data from the Aspen system. So to do so, you contact your MAC to update your information. So the link below will get you to this home page right here, and click on the state, or there's a little drop-down box to the bottom left, choosing the state. And I think the first result would be your MAC contact. So for IRF subunits, so pretty much your T units and then your R units, the rehab units in critical access hospitals, you can update your data through the key software. So in summary, you see the link to LTAC Compare and IRF Compare OR. You can go to your search engine to search for LTAC and IRF Compare. There are 3 types of quality measures, the assessment-based, claims-based, and then the CDC and HSN measure. We went over the 3 reports, the review and correct reports, the QM reports, and the provider preview reports. And these are all accessed through CASPER. So review and correct reports and QM reports are the user on demand, and your provider preview reports are automatically generated and placed in your inbox. And review and correct reports provides the snapshot, facility level performance at the time to report. So just the observed values. It shows your data correction deadline and whether that quarterly data is available for correction, open or closed. And data are presented by quarters, and after 4 quarters, this quarter is dropped. And we have new enhancements on the review and correct reports next year. Your QM reports contains both the facility and patient level information for a single reporting period, also known as the confidential feedback reports. And while the claims-based and the CDC measures are in the facility level reports, they are not not included in the patient level reports. And then your provider preview reports is the data that's reflected that will be posted on LTAC and IRF Compare, and you have 30 days once you receive the provider preview reports to review and submit a request to review your data. And here's the action plan. Become familiar with these on-demand reports and review them carefully for your facility early in the reporting periods, and just review to ensure accuracy. And then utilize these results to assist with your quality improvement efforts and ensure data is submitted accurately. And then review your provider preview reports within 30 days to ensure that whatever is posted on Compare is accurate. And that's it. A lot to go over, but all set. So thank you.